Broadcast is now starting. All attendees are in listen-only mode.
Good evening and welcome to tonight's discussion titled HIPAA Compliance for Eye Care Professionals. My name is Brett Papke. I am an optometrist and I serve as the Director of Eye Care Professional Services with Revolution EHR. Speaking on behalf of our team, we're very happy to have you here. Thank you for spending some time with us tonight. Now, you will note that because this is a webinar, all attendees have been placed in listen-only mode. That's not to say we don't want to hear from you, however, so please feel free to enter questions anytime through the questions area to go to webinar panel. And we will do our absolute best to get them answered either through the course of the presentation or afterwards. With respect to tonight's discussion, very happy to have Revolution EHR's HIPAA compliance partner, Abide, joining us. Specifically, our speaker is Mr. Cole Morgan. He's the Director of Education at Abide. He's going to be helping us understand the requirements on our practices and how to get on the right path for compliance. Remember as well that as we dive into the discussion tonight, that the ultimate responsibility for the protection of data within your practice is with you. So a system like Revolution EHR can certainly provide you with specific technical tools that'll help you reduce risk, and we'd obviously be very happy to show you those outside of this discussion. But it's really, really important that we understand how those tools fit into a much broader security program in our practice. And that's really where an expert partner like Abide can serve you in your practice. So with that as background, allow me to turn the mic over to Cole Morgan.
Thank you so much, Brett. I appreciate it. And we are really excited to be here with you tonight. So like Brett said, my name is Cole Morgan. I'm the Director of Education at Abide. Abide is Revolution EHR's preferred HIPAA compliance partner. We are thrilled to be chosen as the vehicle to carry out today's message and to work with Revolution EHR and all of their members. I'll tell you a little bit more about Abide as we go forward. Appreciate you carving out time tonight to join us and jump on here. As you can see from the title of the webinar, tonight we're going to simplify HIPAA compliance. So we've been doing these webinars for a while. Revolution EHR members, users have really benefited from this education. So we expect you all to have the same experience. So we'll go ahead and there's my mug on that slide right there. That's my contact information. So we're going to start with, what does HIPAA stand for? It's a good thing to start with. It's the acronym HIPAA. This is what it actually stands for, and what it tells us about HIPAA compliance is not a whole lot. This acronym is about as confusing as a lot of the rest of HIPAA compliance. So it's the Health Insurance Portability and Accountability Act. When we look at the timeline of HIPAA, where we've started and where we are now, it's a 25-year-old law. It was established in August of 1996. But if you look at the timeline here, you'll see the OCR, that's the Office for Civil Rights, the federal government, they did not commit to enforcement until March of 2013. So when it comes to HIPAA compliance enforcement, still relatively new. When you look at 2016, that's when they started a proactive audit program. So again, we're just beginning to see the results of this renewed focus on enforcement from the government. When we look at where we stand right now, pretty early in 2021, there are some proposals that are in place to kind of change up some regulations on HIPAA compliance, looking at shortening up some timelines and things of that nature. We're keeping a close eye on that. Obviously going to let all of our customers know about that as soon as anything happens and reflect that in our education. Who we are at Abide. We are a technology company down here in Tampa, Florida. We're comprised of HIPAA leaders and experts, and our goal is to provide HIPAA education and solutions for eye care practices. So the reason Abide exists is we understand the eye care practice, your practice environment is different from that of, say, a large hospital system. Where a large hospital system has a big compliance team, that's all they're focused on, we understand that's not realistic for your practice. So we want to provide you with the same ability to be as compliant as that big healthcare system, but with the resources that you have available to you. When we look at today's agenda, we're going to go over some enforcement examples. We're going to look at stats and trends from some recent HIPAA audits from the government. We're going to have you take a HIPAA challenge. This is going to show us where we stand as a practice. Then we're going to talk about the important stuff, the path to HIPAA compliance. And then at the end, we're going to show you how we can help you get HIPAA compliant forward. When we talk about HIPAA investigation triggers, so there are 3 things that can trigger a HIPAA investigation. It's a patient complaint, a breach, or that proactive audit program that I talked about. And as you can see here, patient complaints are increasing dramatically. So this is obviously a trend that from your perspective should be eye-opening, especially when we think about the fact that all it takes is one single patient complaint, even if it is totally unfounded, to lead to a full-scale HIPAA investigation of your practice. When we move on to this slide, I always like to talk about this slide. When I talk to practices every now and then, I'll talk to a practice or a doctor, and they'll tell me, well, we've been doing what we've been doing with HIPAA compliance for 20 years, 30 years, we've been fine. This slide here tells you why that is not a valid argument anymore. When we look at HIPAA fines in the last 4 years alone, that's 75% of the overall total. So HIPAA enforcement is here. It's here in a big way, and it's not going anywhere. When we look at HIPAA fines from last year, I want you to specifically look at the majority of this pie chart, and that is that 95% of the HIPAA fines last year were from a cyber event. So when we say a cyber event, what it's important to realize is that the breach was not necessarily what caused the fine. It wasn't that these practices were just unlucky. The breach acted as a trigger point for the HIPAA investigation, and then the OCR found systemic noncompliance, as they put it, in every single instance. The second largest category you can see there is patient right of access. So that's where practices failed to provide patients with their records upon request, and the patients complained to the OCR as a result. So what this tells us, what we hope it tells you, is that the triggers for these investigations were in most cases outside of the practice's control, but it still led to a large amount in fines and breaches because they didn't have any of the HIPAA basics in place. When we look here, there are monetary fines that go along with HIPAA violations. As you can see, they're broken down into 4 levels, and they go up in severity with the egregiousness of the violation. We don't talk about this too much, but what we want to point out is the minimum fine that we have ever seen for a HIPAA violation is $3,500. So this is not a scenario where it's like getting a parking ticket and we pay our $100 fine and we move on. This is a lot of money. To talk about HIPAA penalties some more, there are criminal penalties when it comes to HIPAA violations. These are rare, but we do see them. They're reserved for the most egregious and really for malicious acts. It shows you how serious the government is about HIPAA compliance if they're going to tack jail time onto something like this. So this is some good news for 2021. This is one of the new laws that we've seen get passed, and it was passed January 5th. So the government has taken a huge step in incentivizing covered entities to protect themselves from HIPAA fines. So what the government has said is because of that rise in cyber breaches, if a practice complies to the HIPAA security rule and implements appropriate technical safeguards for any vulnerabilities that they identify in their security risk analysis, and they can prove that with documentation for a period of 12 months prior to any incident, like a breach, a patient complaint, or a proactive audit, the Office for Civil Rights will reduce fines, cut short any HIPAA audits, or reduce any corrective action plans that otherwise would have been levied against that practice. So this is something good to see. We hope that we see practices take advantage of this. So now we're going to do a HIPAA challenge. This is where we see where you stand as a practice. If you pull out your phone and open up the camera and just hover it over that QR code, it will open up the HIPAA challenge. You can also type abide.com/HIPAA challenge/revolution EHR into your browser search bar, and it'll pull it up that way as well. So open that up, take that. We want practices to be honest with themselves because this is going to give us a good idea of where you stand. And that's the only way to know how we improve and what we need to focus on moving forward. So go ahead and knock that out. I'm going to keep going on while you all do that. So while you're doing that HIPAA challenge, I want to talk about the definition of compliance. Typically what we see with practices is that, they have good intentions and they really usually have good habits in place. So we call those things a culture of compliance. The culture of compliance at your practice is what's protecting your patients. The way that we need you to look at HIPAA compliance going forward is by this definition, and that's documented proof that there is a culture of compliance within your organization. The culture of compliance protects your patients. The documentation protects your practice. You can have the Fort Knox of HIPAA compliance programs, but if it's not documented properly, you are not going to get credit for that. So that's what we're going to focus on going forward, is the documentation, what that looks like. And what we want to do to make that a little bit more digestible for everybody is break HIPAA compliance down from this big scary blob that it can kind of be. And we want to look at it the way that the government views it, the way that an auditor will view it. So this is what makes up a HIPAA compliance program. All of these parts and pieces, they're all working together, and we all need each piece to be truly HIPAA compliant. The first thing we're going to talk about here is a risk analysis. So some of you may have heard of a risk analysis before. Some of you may have even done a risk analysis before. This is the responsibility of the practice. What we are doing with a risk analysis is a self-assessment of 3 categories: physical, technical, and administrative. We're documenting the safeguards that are in place, and we're assigning a risk level to those safeguards to know where we stand and to know what we need to work on throughout the year. So this is the responsibility of the practice. It's the first step in HIPAA compliance. It's also the first thing an auditor will ask for. The government has come out and said compliance has not been achieved without a documented risk analysis. For any of you that are participating in MIPS, a MIPS practice gets audited 1 out of every 6. So there's an elevated urgency to making sure you have a risk analysis, but everyone has to have a risk analysis up to date and in place to be considered HIPAA compliant. When we look at the risk analysis, that comes from what's called the security rule. When we look at the rest of this puzzle, it's coming from what's called the privacy rule. When we talk about the privacy rule, this phase of HIPAA compliance is going to be risk mitigation. The privacy rule says you have to have an ongoing compliance program to help mitigate any of the risks you found in your risk analysis. This is a fairly logical next step, right? We're going to identify risks in the risk analysis, and then we're going to work on mitigating those risks. The next thing you need to have in place is a HIPAA training program for your employees and doctors at a minimum once a year. The best practice and our recommendation is to conduct the training in a modular type format, which requires you to give a quiz at the end of the training. We also recommend all new employees should be trained within 30 days of coming on board. Next is policies and procedures. So this is a big one. Your policies and procedures must be drafted specifically to your practice and identify how your organization addresses the security and privacy of protected health information. These are vital documentation in the case of an audit. If we think about it from a tax example, this is your tax documentation, right? These are your receipts. This is proving in written documentation that you're doing everything that you say you're doing. The other thing we want to be careful of, and it's because we've seen the government actually mention this in their audit report, they called out practices that had generic policies and procedures. They need to be, like I said, specific to your practice. You also need to be looking at state regulations and federal regulations, because there are some policies and procedures that have differing timelines based on the state that you operate in. So these are all things that you need to be paying attention to with your policies and procedures. Patient authorization and consent forms. This is something that we see the majority of practices do a really good job with. If it's something that you're not doing, it's something that you need to start doing immediately, along with the rest of all of this. If it's something that you are doing, we obviously want you to keep doing that and work all of these other puzzle pieces into your HIPAA compliance program. We want to make sure everyone realizes that patient authorization and consent forms do not make an entire HIPAA compliance program. It's not just these forms. It's all of these pieces of the puzzle working together. When we look at a HIPAA manual, I always think of like a 3-ring binder that goes on the shelf here, and that's not necessarily what the government needs to see from you for a HIPAA manual. So this can either be physical or electronic. And we strongly recommend that you at least have a copy of all your documentation in electronic form so that you have access to it in case that there's a fire or a flood. This is a lot of documentation. It would be a tragic day if your only physical copy of this stuff was destroyed or misplaced. When we look at business associate agreements, so this is a very big point of emphasis for the Office for Civil Rights lately. So a business associate is any third-party vendor that potentially has access to your protected health information. And what the business associate agreement does is it offsets liability from your practice and onto that third-party vendor, saying that, hey, everyone here is doing what they're supposed to be doing from a HIPAA compliance standpoint. We stress these a lot right now because we've seen more and more recently that business associates have an increased role in practices getting investigated and getting audited. So if you have business associate agreements, make sure that they are up to date. Make sure that you have them with everyone that needs them. If you don't have business, it's something that we need to get in place immediately. Finally, the last piece of the puzzle is an updated risk analysis. So this is a big pain point for a lot of practices. We have to do the risk analysis annually, but we also have to update it throughout the year. The government wants to see it at minimum once a year, but what we've found is that every time you go and try and do that, it's like you're reinventing the wheel. So what we want to do is update this as frequently as possible. I'll show you when we get to the end how Abide continually updates your risk analysis and makes that a really efficient process for practices. But the reason why it'd be up to date is because that's going to be the most accurate reflection of what you have in place as safeguards at the time. We also know that auditors will ask for your most recent risk analysis before any kind of disclosure or incident. So this is what any good HIPAA compliance program looks like. All the pieces come together, they work in unison to create your culture of compliance and document that culture of compliance. When we look at enforcement trends, this slide here is the results from the latest government enforcement report. So these are some pretty staggering numbers. When we look at it, the government's come out and said only 2% of covered entities met all HIPAA requirements. When we dive deeper into these results, it's important to look at these as areas that the Office for Civil Rights sees as an opportunity of enforcement going forward. So they've obviously identified them as weak spots, and we want to continue. They're going to want to continue to enforce those areas when practices don't meet those requirements. The first bar chart you'll see here, only 2% of practices met all notice of privacy practices requirements. So this means most practices failed to provide the required document to patients, or they had something that didn't meet all the right requirements for where to post it or what information should be included. Only 11% of practices met patient right of access requirements. So not meeting requirements either means practices didn't meet the right time frame standards for providing records, or they didn't provide the right type or format of records requested. 67% of entities failed to meet breach notification timeframe requirements. So that means when a breach occurred, they didn't let patients know within the lawful timeframe. That's essential to meeting HIPAA breach notification rule requirements. Only 14% of covered entities have completed a security risk analysis. By that, we mean an appropriate government standard security risk analysis. This is one of the most common issues we see among practices. And lastly, whether or not they completed a security risk analysis, even less, only 6% actually implemented an appropriate ongoing risk management program around their results. So the common themes here are around patients, basic HIPAA requirements, and handling breaches correctly. So you can bet that the OCR will continue enforcing these areas this year and moving forward. So a very specific area to focus right now for the Office for Civil Rights is patient right of access. So this was highlighted in those audit results that we just looked at. Last year, the OCR was busy getting in numerous access-related fines. They issued 5 fines in 1 day in September. That was a record-breaking high, in addition to settling 11 total right of access fines in 2020. So these are practices that either delayed providing access to patients' records when requests were made by the patient or by a patient's authorized personal representative. Just some notes to look at: the longest it took one of these practices to provide records was 36 months. Just to put that in perspective, the federal requirement to provide records is 30 days. These can vary by state. So again, that goes back to talking about policies, procedures, and understanding what your state requirements are along with federal. But the fines we saw here ranged from that smallest fine ever, $3,500, all the way up to $200,000. And the average fine for a patient right of access violation was $27,000. This is a huge point of focus for the government. When we look at takeaways, the first one, again, is meeting those timeframes that are required to provide patient records and knowing what those timeframes are depending on your state. The other part of that goes back to policies and procedures and having that proper and required content within your policies and procedures to show that you're following these guidelines. So another big trend for enforcement comes from cybersecurity. We looked at the 2020 fine totals, and again, 95% of that came from cyber-related breaches. Things to note: just because, like I said, there was a breach does not automatically mean there's going to be a fine. If you have the documentation in place that you're supposed to have and you do what you're supposed to do, obviously that protects the practice a lot more than not following the guidelines. We also saw a record number of breaches from both covered entities and business associates last year. So that's why it's essential to have those business associate agreements in place. And remember, the HITECH Act, that law touching on HIPAA, but really it focuses on healthcare technology, was just amended to have that safe harbor law. So if you have the basic measures that are in place and you're following the HIPAA security rule and can document that for 12 months, then you're going to be able to take advantage of that safe harbor law. Again, the takeaways are having basic technical safeguards in place and keeping an accurate log of all of your assets, your devices, any encrypted data, having positive control over that, and being able to show the government that you have positive control over those things. Now, again, to talk about business associate agreements, we've mentioned this a couple times already. As far as business associates go, the most important things to note are record fines have been levied against business associates for not having the required business associate agreement in place. Makes your practice just as liable if a breach happens, and even though it has nothing to do with you. Associates like EHRs and data hosting centers are typically big targets for cyber attacks, so it's essential to have agreements signed with each of those, and obviously vet out your business associates and make sure you're using a business associate that's taking steps to protect your patient's data. Last but not least, again, having your vendors make sure they have the same safeguards in place and are protecting your PHI on behalf of your practice. You have that right to vet out your vendors, to talk to them about what they're doing to protect your practice. Get those business associate agreements signed before working with a business associate or before there's any possibility of an incident. And also, again, ensure those vendors are using proper safeguards for your protected health information. So we're going to look at some federal and state audit letters. OCR audit. This is a federal audit. This was an eye care practice that had a laptop stolen from one of their practices, and it triggered an OCR audit. They were already a buy customer, So our support team walked through the audit process with them. They obviously had all of their documentation in place to prove that they were HIPAA compliant. This was the letter we got back from the OCR that said they were closing their investigation with no corrective action needed, and more importantly, no financial penalties levied against the practice. So this is a good example. If you have the proper documentation in place, and you're doing what the government asks, you're protecting your practice. And then this example is also from last year. You can see the audit letter from a state attorney general after a data breach. So the interesting part of this audit was the information that was breached was not social security numbers, it wasn't names, it was only email addresses. When it comes to HIPAA, email addresses are considered protected health information. So when this office manager accidentally CC'd 400 other patients instead of blind copying them on a promotional email, that was what constituted as a HIPAA breach. The other thing we want to point out with this audit is look at all of the information that just that email breach caused the practice to have to provide. The state wanted to see administrative, technical, and physical safeguard policies and procedures. And again, those are hitting all three categories on your risk analysis. They also wanted to see the risk analysis conducted immediately before the disclosure. So that's why that updated risk analysis is so important. We know that they are going to ask for that and that they want to see that. So to wrap up, these are the questions that we want you to ask yourself in your practice going forward to make sure that you are complying with HIPAA. One, how are you going to complete your risk analysis and keep it up to date? How are you going to draft your documentation, those policies and procedures, and update those? Do you have a HIPAA training program in place? How are you going to get one in place and execute that training and conduct quizzes? And then how are you going to stay up to date with HIPAA changes, both on a state and federal level? The last question, and really the biggest of all of them, is if any of these things were to happen tomorrow, because nobody is immune to a data breach, an audit, or a patient complaint, do you feel comfortable with the documentation you do or don't have? So if you're questioning it at all, your compliance program, or some of these questions are hard to answer, that's why we've partnered with Revolution EHR, and that's why we're here doing this education tonight. So I'm going to jump over really quickly and show you how we can help you. We have a wonderful support team that can answer any and all HIPAA questions and problems that you have. We have an automated software that is the most efficient on the market for handling HIPAA compliance. And we provide audit protection in the case that you need that. So let me jump over real quick, and we're just going to take a quick overview of Abide. So Abide is a cloud-based software, just like Revolution EHR. When you log in, this is what you'll see. This is your HIPAA compliance dashboard. Our dashboard is run by our notification system, so there's no guesswork with Abide. You never have to wonder, did I update everything? Is there anything else I need to do? Man, I hope my HIPAA compliance program's good to go. We're going to tell you anytime we need any input from you. Now, the great news is there's not a whole lot of input we need from you. The majority of Abide is automated. We are going to take everything with HIPAA compliance off of your plate that we can. The tasks that we do ask you to do are extremely simple. We're going to have you answer yes, no, or don't know questions. We're going to have you complete your risk analysis. And from there, you're answering 3 to 5 ongoing compliance questions a month. That keeps your risk analysis up to date monthly. That will always be reflected on your scorecard. We're going to electronically send out and have your business associate agreement signed. And we're going to send your training videos out on an automated basis so you don't have to remember when you did training last or when training is due. Let us handle all of that. Let us worry about HIPAA compliance. Support and audit protection are the two features that really stand apart for us based on the competition. We want you to have full confidence in your HIPAA compliance program. So if there's any questions, you have support to click on, ask them a question. They are HIPAA experts, HIPAA geniuses. And then lastly, if you ever need it, God forbid, we have audit protection. So you click this button, you tell us you're being audited. It's all hands on deck. the boss, Matt DeBlasi, our president of our company, gets an email. Everyone is aware. Everybody is there to help and get you through that audit. We have never had an Abide customer fail an audit or pay a dime to the government. We're extremely proud of that track record. So that's how we can help you with HIPAA compliance. That's how we can reduce this. Just to wrap up here, what we have to offer for Revolution EHR members get 25% off and using this promo code CLOUD25 until March 11th. So if you go ahead and jump on board with Revolution EHR, we can also get your HIPAA compliance issues handled with essentially 3 months free. So that's all I've got. Brett, I'm gonna pass it back over to you.
Thanks, Cole. That was awesome. That 14% SRA statistic was a little bit alarming. I know from talking with a lot of doctors, I know one of the challenges with it is it just sort of feels funny to say, no, I don't have this in place, or no, I don't have that in place. You sort of feel like you're incriminating yourself. But I think you made the point very well that the SRA, that's the point of it, is to find those risks and then mitigate them through other policies and procedures that you put in place.
Yeah, what I always say with a risk analysis is no one's going to get 100% on it. It's not a goal of being perfect. It's just a goal of knowing where you stand and identifying what your low risks are and what your high risks are. That's what the government wants to see, is that you're taking the efforts to identify what you're actually doing.
Could you make the argument that if someone did produce an SRA that had absolutely no security risk, that would set off red flags in itself?
Yeah, yeah, because I would say that they're probably not digging deep enough, or they're not asking the right questions.
Yeah. Speaking of questions, do you have some time to take some from the audience?
Yeah, absolutely.
The first one says, I started a new practice late last year. I'm only seeing a few patients a few days per week right now. Is an audit risk less for me?
No, it's not. When we talk about Abide and being able to provide a private practice and independent practice with the same ability to be HIPAA compliant as like a big hospital system, that's because the OCR does not discriminate when it comes to who they audit. They audit large, they audit small. It does not matter if you're open 1 day a week or if you're open 7 days a week. If you have protected health information and you're handling that, as a practice, you need to be HIPAA compliant.
Good. This sort of dovetails off of that, I think. Given everything else that's going on, is the government likely to focus on HIPAA right now? I think you may have addressed that during the course of the presentation, but feel free to do it again to drive the point home.
Yeah, definitely. So again, HIPAA enforcement is still, we're really only seeing the tip of the iceberg with it. And so that's what we're trying to do, is get out ahead and be proactive and educate practices about, hey, this is what the reality of it looks like, and this is where we're headed. So yeah, I mean, with COVID and everything, I know everyone's had a tough year. It's been a long year personally and professionally for a lot of people. But unfortunately, that does not excuse not being HIPAA compliant in the government's eyes. We're actually seeing an increase again in patient complaints, and that's because people are more aware of HIPAA than they've ever been with COVID and medical information. So actually, our phones have had an increased ringing volume because people have been Googling HIPAA, find Abide's website, and have actually called our support team to ask to file a complaint. And we have to tell them, like, that's not what you do with us, but we have to tell them where to go to do that. But yeah, it's not slowing down, no, just because of COVID, unfortunately.
Okay. This one's a bit more general in nature. What is an example of a business associate agreement? I know you shared the Abide portal there where you have the business associate portal. Is it possible to speak to that question?
Yeah, so what it is, it's a legal document, and what the legal document is calling out, it's got your standard indemnifications, responsibilities of parties, and all of those things. But what the business associate is doing by signing that is it's meeting what's called the omnibus rule. And what they're doing is acknowledging that they are taking proper steps to protect your patients, your PHI. And so that's why helps cover the practice is because it shows that, hey, you took the effort to go out there, get this document signed, and meet that omnibus rule under the government standards. So it's really, ours is a 16-page legal document.
Other than the EHR vendor, an insurance clearinghouse, and say a patient engagement solution, can you give examples of other entities that an optometry practice might need to have a business associate agreement with?
Yeah, so a shredding service, any kind of outside billing company, even lawyers and CPAs, those kinds of people. It's anyone that's going to touch or could potentially have access to that protected health information.
Okay. I think you might have touched on this in the presentation as well. If I completed a security risk analysis a few years ago, but I haven't done one since, does that put me in a bad position?
Yes, it does. It leaves you extremely vulnerable to not only an investigation, but also if that investigation, were to take place, to receiving a fine from the government. It's like we mentioned, it's an annual requirement, and it also has to be updated at a minimum once a year.
Okay. I'm seeing one more here. I'm using paper records, but have been considering moving to an EHR. Is one approach safer from a HIPAA perspective?
So the answer is no. Paper versus EHR, they each have their own vulnerabilities. That's the thing with HIPAA. There's no perfect way to avoid any kind of vulnerability. So while the vulnerabilities that are presented while using an EHR company might not be the same as the vulnerabilities that a practice using paper only sees, they still have vulnerabilities, and one isn't more or less vulnerable than the other, really.
Okay. Well, that's the extent of the questions. So if any other trickle in as we're wrapping up, we'll certainly address those through email after the fact. So Cole, thanks again for your expertise and your insights this evening. To our audience, thank you all again for your time. If you have any questions about Abide, I know their team would love to hear from you. As far as Revolution EHR is concerned, I'm going to launch a poll here as a means to offer a way for you to get more information about our platform and the technical safeguards that we offer. Remember that saying yes here isn't an obligation of anything on your part. It's simply an opportunity to see Revolution EHR and learn a little bit more about how it can help your practice. So if you take a moment to select an option there, we'd certainly appreciate it. I see that most people have submitted, so I will close the poll here in just a second. And with that, I will say thanks to everybody again for attending, and we'll end the presentation with well wishes for a great rest of your evening. Have a great night.